Hello again. You are watching today on eNCA DSTV channel 43. We hope shortly to take you live to the ANC's briefing about those who will be nominated to be in its new National Executive Committee come December. But for now, let's talk about this story. As the country and the world is commemorating World AIDS Day today, being the 1st of December. This day serves an opportunity for communities to unite in the fight against HIV, show support for people living with HIV, and remember those who've died. But it is also intended to highlight inequalities that are hindering progress in the country's efforts to end AIDS as a public health threat. The South African National AIDS Council is holding a national event in Bloemfontein, Komangaung in the Free State to raise awareness about the status of the pandemic. Our reporter, Moloko Moloto, is following that story for us, joining us now live from the Free State. Good afternoon, Moloko. So what's been happening there? What is the government saying about efforts, the new efforts that might be required in the fight against HIV/AIDS?
Well, good afternoon, Braden. As you say, this is a national commemoration day. Our viewers would recall that it was actually conceptualized by ministers of health coming from various countries around the world. They met on this day in 1988, and they agreed that in order to increase the attempts to eliminate HIV, this day needs to be held as a commemoration day across the world. So it is happening today in South Africa, and it's happening under the theme Equalise and Integrate to End HIV. And interestingly, we know in terms of the statistics, Braden, that there's about 38 million people who are living with HIV across the world. In South Africa, there's about 7.8 million people who are living with HIV. And the United Nations, or countries affiliated to the United Nations, met sometime in 2016, and they made a commitment to end HIV in the world by 2030. We are now 7 years away from that particular deadline, and if you look at the numbers, it doesn't look like we will be able to meet the deadline. Now in South Africa, of the 7.8 million people who are living with HIV, only 5.9 million of those are having access to ARV treatment. And we have heard from the experts, and even today the speakers, as they were taken to the podium, emphasizing the importance of having access to ARVs, because they say it suppresses viral load. In simple terms, the people who are taking the ARVs religiously are effectively not infectious. They will not be able to infect their partners. Now, that is one of the methods as the country we will be able to defeat HIV. Unfortunately, as much as the Minister Joe Phaahla said that in the country we do not have a problem as far as availability of ARVs is concerned, the difficulty is that it is not possible at this point in time to reach out to everybody, and some of the people do not even have an idea or do not know their status. But let's listen to Minister Joe Phaahla, who was delivering a keynote address on behalf of Deputy President David Mabuza, who was meant to address this event in his capacity as the chairperson of the South African National AIDS Council. Let's listen to the minister.
We are currently at 5.7 million, so we're still short of almost close to just under 2 million people who we still need to reach. We were, as I said, pushed back by the COVID pandemic, where outreach programs had to be curtailed, and even basic services. We are now ramping up. As I've mentioned, we have our catch-up plans, working with our civil society and all other partners, PEPFAR, Global Fund, and all the providers, to make sure that we can reach people where they are, in the same way as we went out to test people for COVID.
Yeah, Moloko, so has the national program now for today's terminated, or what's next on the program?
Well, Braden, indeed, the program has officially ended. But let me highlight that some of the people who were speaking at this event include the ambassador of the United States to South Africa, who indicated that since 2003, the government of the United States contributed about $9.8 billion in the fight against HIV in South Africa. Also, Zingiswa Losi, who is the president of COSATU, took to the podium to say that the prevalence of HIV infection in South Africa is affecting in the main the working class, the people who are workers, and obviously women bearing the brunt of that. And also the minister saying young people in particular are vulnerable. Young women in particular are vulnerable, and we are seeing as a country the numbers increasing. But we also had an opportunity to speak about the issue that affects the president. We all know that the panel that had been mandated by Parliament to determine whether President Cyril Ramaphosa has a case to answer to, or whether he must be impeached or not. Now, we asked Zingiswa Losi from COSATU's point of view, since COSATU is an alliance partner of the ANC, and she says, look, we have not, as COSATU, as the structure or the Central Executive Committee, deliberated on that report. It was released after the meeting of the Central Executive Committee ended. But she's saying they are going to allow the ANC to sit in their National Executive Committee meeting that we understand is taking place today, and they will express themselves. And Joe Partler saying that, look, there are processes that they believe must be followed that will determine the future of the president.
Thank you very much, Moloko Moloto. We have to leave it there. We are following that ANC story. And of course, we're waiting for the ANC to begin a briefing about the nominations for the National Executive Committee members come December.